Are you tired of being told surgery is your only option for your herniated disc or sciatica? I've helped thousands of patients eliminate their pain, avoid surgery, and get back to pain-free living using a unique method with a 90% success rate. Today, I'll reveal how non-surgical spinal decompression, the cornerstone of our Back to Life method, targets 3 key components to fix the root cause of your back and leg pain for good. It's the same method used with patient Tina, who came into our office suffering from severe sciatica, which severely impacted her abilities to play with her grandkids. After undergoing spinal decompression and following our Back to Life method, she is now pain-free and enjoying her grandkids better than ever before. Now here's the key. Missing any one of these 3 crucial components could mean chronic suffering, more pain, and never fully resolving the problem. Hi, I'm Dr. Ruminder Birk. At our clinic in Woodbridge, Ontario, Canada, we're passionate about giving people their lives back. Our focus is on non-surgical spinal decompression, targeting the underlying causes of pain, from herniated discs to sciatica. Our proven Back to Life method provides lasting relief without the need for surgery invasively. Be sure to hit the subscribe button if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your back and leg pain at home. I'll upload a new video every week. In addition to that, I wrote a book called Back to Life. Imagine getting your life back while getting your health back. You can get a free copy in the link in the pinned comment below. Most of my patients come to me already knowing they have an L4, L5 disc bulge or an L5, S1 disc herniation. They've tried everything: physiotherapy, exercise, acupuncture, pain relievers, muscle relaxants, cortisone injections, nerve blocks, and even nerve ablation therapy. The first question that comes to my mind is, if all those treatments worked, why are they still in pain, and why are they in my office now? The answer is simple. They're still in pain because their herniated disc was never corrected at its root cause. They've never received true non-surgical spinal decompression, which directly addresses the underlying problem. And that's what makes us unique. We have a proven 5-step process for relieving pain and restoring you to full health. I've posted several videos that walk through this 5-step process, and I've included the links in the description box below. The decompression table we use is called the DOC spinal decompression table. So the DOC is a very unique spinal decompression table. It's a smaller table than the old tables, which were bigger and bulkier. This table can be used for 2 areas of the spine, the cervical and the lumbar. It's unique that it also allows 3D spinal decompression. We can move this table up, left, right, rotations can be done to target your L4, L5 disc and specifically get to the exact level that needs the correction. So using these tables, we've helped countless patients feel true relief of their symptoms, some as quickly as 1 or 2 visits, and generally through the program of care, they all show improvement over time. 90% success rate. So this is the best table on the market, in my opinion, because its versatility, so many functions. It's the best table that's best for the treatment that you need. It is important to understand how non-surgical spinal decompression works, and I'll explain it as I walk you through the 3 main components, which are target the root cause, build up the disc, relieve nerve compression. So how does spinal decompression target the root cause of the disc injury? Now, when spinal discs are injured, they often develop annular tears. So these are tears along the disc inside that lead to the bulging disc or the herniation occurring, which leads to inflammation and intense pain that can compress nearby nerves, resulting in severe low back pain and excruciating leg pain. Often, some kinds of spinal distortions are creating the abnormal loads. So if we look at the spine and we see a shift in that spine, whether it's at the pelvis level, whether it's at the disc level from a spinal subluxation, a misaligned vertebrae is going to lead to the disc weakening and eventually herniating. So what it does is it compresses and chronically pressures that disc. So unlike simple traction and stretching, the spinal decompression uses a targeted rhythmic pulling and getting these vertebrae to start decompressing again, eventually at the level of the disc herniation. This creates a negative pressure within the disc and allowing it to expand as water and nutrients flow back in. So as you can see, the disc is compressed. The pressure that's been there has been been there for a long time. It's pushed the fluids out. So as we're pulling this apart, that negative pressure allows a vacuum effect. And this physical pressure on the disc and the injured discs, and it allows promoting true healing from within. By addressing the core issue, reducing the pressure, reducing and restoring disc health, and correcting the underlying spinal distortion, spinal decompression truly targets the root cause of the injury. So how does the spinal decompression build up the disc? So after removing the compressive force on the disc, the next two critical components are needed for injured and herniated discs to heal: water and nutrient building blocks. The only way for water and nutrients to enter a disc is through movement, a process known as imbibition. Imbibition only occurs when there's a spinal movement, and that is exactly what spinal decompression achieves, which is why it is so effective in rebuilding the disc. In fact, non-surgical spinal decompression is the only treatment that facilitates this process at the level of the disc, making it both unique and highly effective. So far, we have reduced the pressure on the injured disc, and through imbibition, we have enabled the flow of water and nutrients, providing hydration and the essential building blocks for healing. Next comes relieving nerve pressure. How does spinal decompression relieve nerve compression? Nerve compression can happen in two ways. Where there's disc degeneration, the disc thins, causing the vertebrae above and below the disc to come closer together, which reduces the nerve space where the spinal nerves exit, called the neural foramen. Where the space in the neural foramen narrows, it's referred to as foraminal stenosis. This compression of the spinal nerve can lead to leg pain, sciatica-like symptoms, and numbness or tingling in the legs or feet. When the spinal decompression table rhythmically pulls the vertebrae apart, the narrowed foramen starts to open up, creating more space and decompressing the nerve, which provides tremendous relief in the leg and sciatic nerve. The second way a nerve gets compressed is when there's a disc herniation, putting direct physical pressure on the spinal nerve. This can also cause leg pain and similar symptoms. As I mentioned earlier, spinal decompression creates a negative pressure with the herniated disc, and this negative pressure essentially pulls the herniated disc, reducing its size, relieving the pressure on the spinal nerves. This is another reason why spinal decompression is so effective in relieving leg pain and radiculopathy. As you can see, spinal decompression is the most effective method for addressing the root cause of disc herniations. It's not only rebuilding the disc with essential water and nutrients, but also relieves the nerve pressure responsible for leg pain. If spinal decompression has been missing from your treatment plan, consider finding a trained and experienced spinal decompression specialist in your area. It could be the key to achieving lasting recovery. If you learned something new about spinal decompression today and see it as a potential solution for your disc injury, please like and share this video. If you have more questions about spinal decompression, leave them in the comments section below. Remember to subscribe to my channel now if you want do-it-yourself tips, strategies, and exercises that will help you relieve and manage your neck and back pain at home. The next video you need to watch is this one, where I walk you through the Back to Life method, my 5-step multimodal treatment for sciatica, disc herniations, L5 radiculopathy. Go and watch this video next.